From the PEP Radio Newsroom, this is the news blast for Saturday, May 24th, 2025. A provision in House Republicans' big, beautiful bill passed Thursday would ban Medicaid from covering gender-affirming health care for transgender people of all ages. A last-minute addition to the measure with the potential to upend care for hundreds of thousands of trans Americans. An earlier version of the bill would have also barred coverage for transition-related care, but only for minors. House Republican leadership unveiled the change and several others late Wednesday in a manager's amendment to win over GOP holdouts to President Trump's tax cut and spending priorities bill after days of marathon meetings across Washington. The bill passed the House early Thursday morning in a 215 to 214 vote, with all Democrats and two Republicans voting against it, and House Freedom Caucus Chair Andy Harris voting present. The measure now heads to the Senate, whose Republican majority has already called for changes. The bans on coverage for trans medical care were made so much worse, really in the 11th hour of this bill, said Caleb Smith, director of LGBTQI plus policy at the Center for American Progress. And what a display of how it's really not just about youth. It's never just been about youth. It's always been about curtailing access to medical care and bodily autonomy. All they had to do was strike under 18 from the bill, and now it's everybody. States typically enjoy a good deal of discretion in determining which services are covered by Medicaid, and 10 already have policies excluding transgender-related health care, according to the Movement Advancement Project, which tracks LGBTQ state laws. In some cases, court rulings have rendered state policies unenforceable. A federal judge struck down a Wisconsin policy excluding gender-affirming care from Medicaid coverage in 2019, and another blocked a similar policy in Florida in 2023. Last summer, the Fourth U.S. Circuit Court of Appeals said West Virginia's Medicaid denial of coverage of gender-affirming surgery, along with a separate North Carolina policy blocking coverage for transgender care for state employees, is obviously discriminatory. There's a wildly strong case for this to be discrimination. It is discrimination, Smith said. It really clearly violates equal protection because what we are saying, essentially, is that if you are a cisgender man and you want to access testosterone, you can have it. But if you are a transgender man and you want access to testosterone, sorry, we're not going to cover that. In a statement after the bill passed the House, Representative Dan Crenshaw, the Republican from Texas, who introduced the provisions restricting coverage for gender-affirming care, said the prohibitions are long overdue. Gender transition procedures are the lobotomy of our generation, Crenshaw said. Actually, Crenshaw, having you in Congress is the lobotomy that Washington has needed for so long. Your removal from office would be a blessing. According to data collected by Smith's group last summer, 28% of transgender adults in the U.S. get their health insurance through Medicaid, and 6% are insured through healthcare.gov or marketplace plans, meaning House Republicans' sprawling package, which also prohibits gender transition procedures from being an essential health benefit under the Affordable Care Act, would impact roughly a third of trans adults nationwide, he said. An estimated 276,000 transgender adults were enrolled in Medicaid in 2022, according to a report released that year by the Williams Institute, a public policy think tank in Los Angeles, focused on issues related to sexual orientation and gender identity. A separate Williams Institute report published Thursday found that gay, lesbian, bisexual, and transgender adults are nearly twice as likely as non-LGBTQ plus adults to have Medicaid as their primary insurance, and cuts to the program would disproportionately affect cisgender, lesbian, and bisexual women and trans people. The number of transgender minors covered by Medicaid is unclear. KFF, a nonprofit health policy research, polling, and news organization, estimates that Medicaid covers roughly 39% of children and teens in the United States overall. The bill that passed the House Thursday would not prohibit ACA plans from covering gender-affirming care outright, but it would restrict care by making it effectively unaffordable, said Lindsay Dawson, Director of LGBTQ Health Policy at KFF. That's the News Blast for this hour. If you are 18 or older, live in Pennsylvania, and are part of the LGBTQ plus community, please visit the Pennsylvania Equality Project website, paequality.com, and complete the 2025 housing survey. Up next, we have the Meadville area weather forecast here on PEP Radio.